Hey everybody, Brian Gallagher here from MEG Business Management and MEG Academy. And today is Tuesday, the 17th, St. Patrick's Day. And unfortunately, my day has been back-to-back, thousands of emails, literally, and tons of phone calls, helping practice owners across the country figure out what to do. Now, if you haven't seen already, you have to go check out the podcast we posted on Monday, the 16th, on how to get connected with tele-PT solutions to bring tele-PT services in your office in a professional, well thought out, systematic manner that's going to live on into your clinic for years to come. Not some fly-by-night, flash in the pan, whip out an iPhone and start doing FaceTime with your patients from home. I'm telling you, sorry about that itch on my chin there. I'm telling you that is not the way to go. Let's think about this and let's be patient and let's do what's best for our patients and our practice. But this video is on strategies. This video is on how I can help you right now, starting tomorrow morning, with the situations you may be dealing with in your clinic. I'm finding some of the most challenging offices in America are coming out of New Jersey and New York, Seattle, and parts of California. I have other clinics that are in Texas, Florida, Arkansas, the Dakotas, the Carolinas, minimally affected. Some moderately affected in Colorado, Arizona, Wisconsin, Minnesota. So I work with owners all around the country. And so I have the liberty of talking to people in states and cities throughout this nation. And I can tell you there are minimally, moderately, and maximally affected clinics. But regardless of what condition you are in, I created a tip sheet that spans 4 primary areas of concern that I think is very, very comprehensive and pretty effective for every single condition, every single office, regardless of the condition you're in. But I'm going to encourage that you click on the link below and you get that tip sheet. And if you can, you respond back to us on our Facebook page and let us know if you have anything you can add to strengthen and enhance that tip sheet. We are stronger together than we are apart. This tip sheet is a starting point with the best strategies that I could possibly put together at this time to help you help your patients. Let's face it, your patients are still suffering from the same conditions. 99% chance they're not infected. And you have precautionary measures, standard operating procedures, and techniques that you can use to ensure the safety of your existing patients so that nobody gets infected in your clinic and everybody is getting treated accordingly so their condition does not continue to worsen and their health continue to suffer. I am looking for your participation in strengthening this tip sheet, if at all possible, for the betterment of our fellow PT owners and therapists across this country. There's about 400,000 of us, and we all need to pull together and help one another. And I'm doing my part to try to give you the best advice and the best information possible for you to succeed in your practice. Like I said, there are 4 areas that I focused on. 1, before they come in, the pre-contact period of time. There are certain things you can do there, such as contacting every single patient and notifying them of your new disinfectant policy within your clinic and giving them a hard copy via email. Then section 2, what to do when the patient does come in. A tip that I have there is make sure that that disinfectant policy is posted on the door when they come into your office. Number 2, in that same section, I recommend you abolish your waiting room. Do not have a waiting room. Your parking lot is now your waiting room. Have your patients come in, stay in their car. They call or text you from the parking lot, let you know they're there. The therapist goes out, waves them in. They come in. They work one-on-one with their therapist in their treatment space, and then they walk them right on out. Caregivers do not sit in the waiting room. We're going to minimize patient contact, patient to patient, patient to caregiver, and when possible, patient to therapist even. The idea and focus here, everybody, is that my strategies that I've put together on this tip sheet for your benefit are to try to help flatten the curve. The more we can flatten the curve, the absolute better. Section 3, what are you doing when they're in the clinic and you're treating them? We're using gloves. We're disinfecting before and after. We are staggering our schedules to do one-on-one treatment sessions. We have reached out to tele-PT solutions, and we are now instituting professional telehealth services for our patients with every single carrier that we possibly can for the betterment of our most at-risk patients so they don't come into our clinic. And last but not least, the biggest section, I put in a section about practice management. What can you do to collect on your old AR more effectively? That one, you're going to reach out to us and we can help give you strategies on that. We have a billing company. We do billing for nearly 100 offices across the country. We have wonderful, proven track record of success with strategies that do work to keep your AR under 15% over 90 days. What can you do with your staff? Do not close your office. That is not, unless you're in ground zero and there's no way around it, do not do that. Keep your office open part-time whenever possible to service the people in your community because they're in need of your help. Now, if you're in ground zero and there's massive community infection, then absolutely abide by the CDC precautions. I'm not asking you to breach those. What do you do with your staff? Do not lay everybody off. Do not terminate their employment. You simply declare that you're putting people on a furlough. They can then pursue unemployment. They can then come back to you as soon as the restrictions are lifted. But what I'd rather see you do, if you're not in a ground zero position where it's dire and it's not in the best interest of your community and you're at risk of contaminating others, if you're not in that scenario, then prorate your schedules, prorate your salaried people, and let's service and help people in a safe, comfortable, cleanly, sanitized environment by keeping our distance, managing our schedules, and educating our public. That's my message for you now. I want you to get this tip sheet. I want you to go to the link below. It'll take you to a landing page where you can download it, you can input your information so we can send it to you. And I want you to comment on it, and let's make it even better. I don't have all the answers. Nobody does. But together, if we all pull together and we share with one another, we're going to do the best job possible for our practice, our staff, our patients, and our community. I hope this reaches all of you, and I hope you find it helpful. The best to everybody.